It's high noon. Are we ready to get started? I'm Harvey Stearns, Chair of the Commission on Aging, and I'm happy to welcome everyone. Happy New Year to everyone. These are eventful days, and today our focus is on how to support and help and better understand the needs of the older adults in the city of Akron, and of course in surrounding areas as well. So I'll call the meeting to order, and the first order of business is the presentation. Susan, are you going to make the introduction?
Yes, it'd be my pleasure to introduce Mr. Sam McCoy. Sam has been with Direction Home 35 years.
32 or 3.
33 years. Has held a variety of jobs, but certainly the bulk of the career has been in our Elder Rights Department. He's been that Senior VP of Elder Rights for many, many years, and has really been a strong advocate and spokesperson and leader in that arena. It's been a pleasure to work with Sam through the years. I've learned a lot in understanding what true advocacy looks like. And I think we can all take some lessons from what that looks like, in our everyday lives, in a micro level as well as a macro level. And so, Sam, with no further ado, I'll certainly be happy to let you take it over.
Okay. Well, thank you, Dr. Stearns, and thank you, Susan. Yes, we've worked together for a lot of years. I said the other day, Susan called me Sammy, and I said you can only work with me if you worked with me 30 years or longer. You can call me Sammy. But
Actually, Sam,
if
you think about it, I actually met you before you really had settled in Akron.
Yes, that's correct, Dr. Stearns. I was still in school at the University of Florida, or living in Tampa at the time. Came back to Northeast Ohio, and glad I did. I'll say that. I'm going to bring up a brief PowerPoint and see if I can't do that with some success. So if you'll hang on, I'll make this happen. Okay. Can you see my slide?
No.
No.
You need to get your PowerPoint up on your desktop, and then
it's there.
Then do share screen.
All right. Well, as I said.
And then with share screen, you click on it, and it'll
now. Let me. Okay, I apologize for the confusion here. Let's try this again. Any better? I'm guessing not.
No, not yet, Sam.
I'm so sorry. Let me.
Sam, if I may say something, click the stop share and then share your screen, because that happened to me before.
All right, let me see. let's see. I don't see a stop share. I'm on share.
Do you see share screen?
Yeah,
Okay, if you see share screen, do you see it on top or at the bottom of your screen?
I see it at the bottom of my
At the
screen.
bottom of your screen. Okay, so you can click the share screen.
All right.
Do you see then on, I think maybe on top of your screen, it will show, I think, stop share on the right-hand side in red, and then I think on the left-hand side.
Don't see that.
Oh, okay.
There you go.
Yeah,
All right.
There you go.
Still?
yeah.
we're ready.
Okay, good. Thank you. Thank you for that. I want to talk about the impact of COVID-19 here, particularly in long-term care in Summit County. I want to look at a couple of different perspectives here from the perspective of our resident care and services, the operation of the day-to-day operation of the facilities, and also want to spend some time and talk about the impact upon visitors and families. And that's really an area of great concern for ourselves as advocates. Quickly, I wanted to give a little bit of an overview of particularly of Summit County. Summit County ranks 4th in the state with the number of long-term care facilities, 87 licensed nursing facilities and assisted living homes, over 8,000 beds. And those of us who are familiar with the industry recognize that those 8,000 plus beds are really only a snapshot of any one day, because those beds are turned over many times in the period of a year, and there may be a 50% increase on of these 8,500 beds, an actual 12,000 or more who are impacted or seeking care here in Summit County, likely more in fact. And I see the real growth in long-term care here in Summit County to be in the
Can I
assisted.
make sure I'm muted?
Everybody good? To make sure that I wanted to mention that I think the real growth is going to be in assisted living and what we call continuing care retirement communities. That's where the growth is going to be. And in fact, even today, you can hardly go down a residential street in the outskirts of Akron or any of our neighboring cities and not find an assisted living under construction. And the reason, of course, for that is, investors and others have found long-term care to be a lucrative investment, and residents, families are looking for a long-term care option other than a nursing home. And so consequently, we see a great deal of growth in the assisted living realm. As Susan mentioned, I am in charge of the long-term care ombudsman program here in Summit County and surrounding counties. And our role here is to really investigate and resolve complaints. We are, we're the complaint desk here in long-term care in the county. As I kind of jokingly say, nobody calls us happy. People call us unhappy, frustrated, and concerned about someone they love in a long-term care facility. So our role primarily is to investigate and resolve complaints, bring some satisfaction to that individual, that resident, that client, if you will, to get a correction or resolution to their complaints. We do a lot of public education, outreach kinds of things, such as I'm doing here today. Provide lots of information to consumers and about things like what home has the best performance record in Summit County. What's the most recent survey findings on any particular facility? And we have access to all of that information, make it available to consumers. We also work within the industry to monitor laws and rules and so forth, and try to exert some rights-related information or language into rules and laws to help protect our clients. I think one of the most important things we do as advocates is to establish our presence in facilities. And I often say, and folks have heard me say, that being there means better care for a resident. And whether being there is accomplished by a family member, by an advocacy group such as the Ombudsman, by friends and others, just simply being in the facility and being available to observe, to talk with that resident, get an idea what's going on. It is so critical. And of course, since the COVID era, 10 months or so ago, we haven't been in facilities, and I think it's a significant problem that I believe we've overcome a great deal here from this program. We have been able to overcome some of those barriers, and we certainly are always interested in person-centered care, starting with the perspective of the consumer themselves. What's their day like? What are the issues that they're encountering?
Hey, Sam, are you able to forward your slides?
Yes.
Okay.
To the group?
But no, I'm saying, at least on my side, we are still seeing the first slide.
Oh, no kidding.
Susan, I sent them to you. Look
Oh,
in your
no,
email.
I have the slides. I'm saying for the presentation right now.
Why is that occurring?
Are others experiencing that too?
Yes, I think
Yes.
Sam, you have to
Yes,
go
I
to
am.
slideshow. You have to go to slideshow, click on slideshow, and then click from beginning.
Yeah, I'm
Sorry for the interruption, Sam.
Oh, no.
There you go.
There we go.
Well, I was seeing them all.
Oh, and I'm sure they're fantastic.
All right. Impact, resident care and services, facility operations, families. Got it? Here's Summit County. As mentioned, 8,500 beds. Here's what we do. Investigate and resolve, work with families, be an advocate. Everybody still with me?
Yes.
Yes, thank you.
I knew what I was doing. Here's some activities in calendar 2020. And this is Summit County alone, 637 complaints. I compared that with the year prior. Our nursing home complaints were really steady of those 637. We were steady with 2019, and I think that's an indication of still being able to be good advocates and be strong advocates even in the COVID era. Assisted living complaints are up 60% over the prior year. And part of that, this is Summit County only, part of that is that, the number of beds and number of facilities is greater, but also we're seeing assisted living facilities working with residents that are more and more frail, more and more demented, need more and more acute care. And if those of you who are familiar with the rules in assisted living, the rules and laws regarding staffing, for example, the rules and laws just have not kept pace with the way the industry has changed. So we have seen a significant increase in the complaints within the assisted living facilities. Verifications still remain high. 73% of our complaints are verified, meaning we were able to confirm that from the information that we have, it appears that the information or the complaint was accurate. And then a resolution rate of 86%, meaning that our involvement brought some resolution, some positive change to the situation that was encountered by the family. So my next slide, I'm going to ask you about what you might think were the most prevalent complaints during 2020 in nursing homes. And here they are. And it's changed. It's changed a good bit in the past 12 months. Care planning. We know that each resident should have an individualized care plan created for them that addresses their specific needs. We're seeing more and more care plans simply not being fulfilled, not being completed, not being implemented. Things being overlooked. Many times, what we're seeing in the care planning arena here have been the failure to handle some of the details of care, whether it's personal hygiene, whether it's bathing, it's dressing, items in the care plan that were not completed. Visitation, clearly this has been a significant and a significant change in the past year. We've never had visitation complaints being a problem in the past. Lots and lots and lots of visitation issues here in Summit County in 2020. The response to requests for assistance, this is simply nobody answered my call light, or my call light was answered. The aide came in, turned the call light off, and said they'd be back, and they didn't. They didn't come back. Access to information. Families, as you can imagine, families have a difficult time trying to figure out what's going on in the facility. Maybe they can't obtain records. Maybe they can't get the kind of feedback that they had expected and that they deserve. And then my final item in a nursing home complaints is where the facility has failed to treat residents with dignity and respect. That, unfortunately, has always been one of our top 5 complaints for as long as I've been in the ombudsman program. And again, I think this is a reflection of the impact of COVID in nursing homes. Caregivers, staff are working multiple shifts. We've got staff that are having maybe a compassion overload. They just can't maintain that level of compassion and empathy for the residents. They're stressed, they're frightened, they're concerned. They're dealing maybe with COVID in their homes. They're dealing with children, in the home, not being in school, any number of things. And I think all of those pressures can manifest themselves in a failure to treat a resident with dignity and respect. And I want to be clear that this is far, far short of abuse or neglect, abuse or neglect type of situation, but still troubling. And I would expect that this is the kind of lingering problem that will exist in the industry for some time until we have some resolution to some workplace issues.
Sam, can I ask a question?
Yes, of course.
Just real quick, what has the visitation positive outcome look like with the COVID lockdown? Because obviously, you can't force, homes, especially if they were having an outbreak, they're managing the infection control and dealing with them. What does it look like now? And when do you expect that to look differently with the residents getting vaccinated? Because that should
Yeah.
change.
Yes, absolutely. And I have a upcoming slide, Karen, that addresses that. And it's a good question. And I think one that that's going to be maybe have some controversy and going to be difficult for us to unravel as advocates. But I will be sure to address that. Okay, the same kinds of issues in assisted living, visitation, rights and preferences. And an example of the rights and preferences might be that, this will sound maybe kind of silly, but a resident may say, I want to go out with my daughter. I want to leave. I want to go shopping. I want to spend the weekend with my family, and they won't. I'm not being allowed. And we encountered those issues. Believe me, I'm grateful that that facilities throughout our region and throughout the state have taken COVID seriously. But I think sometimes they have put conditions in place and put restrictions in place that just are over the top. They're inconsistent with state directives. And for example, we've had facilities say that, well, the resident can go out and spend the holiday with family members, but they can't come back unless they have 2 negative tests. And that just simply shouldn't be. And we advocate for some leniency there as well. We would expect that those residents would come back to the facility and maybe be in isolation for 10 to 14 days, but not be required to have a negative test. Sometimes these issues have led to discharges and evictions, one of the top issues that we deal with. And again, I think this is in part due to the fact that facilities are trying to maintain their census, and we're dealing at times with residents that they really can't manage in an assisted living situation. Personal hygiene, food services. The food services, a number of restrictions were put in place in an assisted living. And you've been in these facilities. They've got gorgeous, lovely dining rooms, nicely decorated, comfortable, and residents are having meals in their rooms, as an example. So here's some of the impacts that we see, particularly with visitation. As you know, very restricted. Facilities have required for visits to be scheduled in advance, always wearing PPE. Oft times they are time limited, 30 minutes, sometimes less, because of the volume of persons wanting to visit. Maybe you are restricted to 1 visit every other week to allow other families to visit. Always socially distanced, of course. Staff monitoring, and it's unfortunate that facilities feel that they have to monitor visits because we see, because of the the very real circumstance that occurs where visitors, don't want to be socially distanced. And believe me, it is maddening and frustrating to have to try to visit across a table from someone that you care about and you love, and you just want to, you want to be close to them. And we've had circumstances where visitation has been terminated because folks, couldn't play by the rules. And it's also, of course, subject to change without notice. They've got an active outbreak of COVID. All visitation may be terminated at a moment's notice. I highlighted a couple of areas down here below, and that is what we call compassionate care visits. And these are visits that I don't think are very well defined. And I think that's good, because it's easier to advocate for a compassionate care visit when the definition is kind of broad. And it's also important to understand that these visits can be allowable in situations other than end of life. For example, compassionate care visits have been granted, and we have advocated for them for people who are not on hospice care. They're not eligible for hospice, but a family member has been a regular visitor at mealtime, for example. And we've seen a significant decline in weight. And we have successfully advocated to allow these compassionate care visits, allow visitors, family members to come in and be more involved with direct care because of the change in the residents' condition, both mental and physical. So I don't want, if there's a message, I think today, just because the facility says you can't visit, we as advocates are always willing to step up and say, well, I think this is a compassionate care issue. Let's see what we can do. Daily operations, I think the facilities have really been turned upside down. Residents many times have been isolated in rooms, limited in group gatherings, activities, not occurring as we might have expected. We're seeing a lot of room changes going on where there's grouping, I call it, of residents at one degree of maybe they're COVID positive but asymptomatic, or have symptoms and might be grouped with other residents in an isolation type of wing. The critical issue that I've hinted at a number of times here today is the availability of staff. Facilities are really scrambling to get sufficient staff on board to be able to provide the kind of care that their residents need. Paying double and triple time for nurses, paying pool staff or agency staff to come in and assist care. And from a person-centered care perspective, we have caregivers who are providing care to residents that they know only as a name on a chart. And as an advocate, I think that is, that's a problem. The best care is provided by caregivers who are familiar with residents and residents who are comfortable and knowledgeable of their caregivers. We know there's help kind of out there, the cavalry, if you will, and that's the bridge team that's available in those dire circumstances, and that might be the Ohio National Guard that can come forward and put staffing in place for a short period of time until available staff are out of isolation or whatever the circumstance may be. And we've seen the bridge team used in a number of cases here regionally. Here's this is an issue I think that that Karen mentioned. Vaccines are being administered now. I think the governor said over 60% of the facilities have received their first doses. 80% or more, according to the governor, have accepted. That's the residents have accepted and recognized the value of the vaccine. Much more troubling is the fact that the acceptance rate by staff is much, much, much lower. And 50% in some cases, maybe a little bit higher, depending on, I think this is a statewide number. I'm personally aware of facilities that have said they are 100%, their staff have been 100% vaccinated, received the initial vaccine. And I see more, I'm expecting more and more pressure on facilities to, to encourage their staff to get the vaccine. This is kind of what I expect to happen regarding the vaccine. It's, as we know, COVID is not going to go away next week, next month, maybe not until summer, maybe even later. I see the acceptance of the vaccine going to be used conditionally as a reason or for visitors or others to be allowed in the facility. I would not be surprised if facilities wouldn't come forward and say, well, you're welcome to visit if you got the vaccine. I also could see that facilities could use the vaccine as a condition on location within the facility, that you might have a wing or a number of wings that made up of residents who have not accepted the vaccine. And the consequence of that may even be, I haven't witnessed this yet, but I wouldn't be surprised that, you might have end up with a facility that's kind of managed, dually managed in two different ways, that you had rules and policies that apply to those who've accepted the vaccine, including their visitors who've accepted and those who have not. And that might have an impact on any number of kind of day-to-day routines in the facility. I do see, Karen, as you asked, a gradual return to managed visitation. I don't really expect that probably until, maybe in the next 60 days, maybe 90 days. But I do see facilities encouraging families and residents to accept the vaccine for lots of reasons. But it's going to be, I think, a tenuous few months here, just as it would be in our communities, to see that ourselves, friends and families are vaccinated for the virus. It's just really going to be accentuated, I think, under the roof of those long-term care facilities. Okay. Any questions about anything that I've presented here this morning?
I did notice in participants that Donna Barrett is present. Is there anything
Yes.
from Summit County that you'd like to comment on?
I don't hear from Donna. Donna, are you with us?
I am.
Okay.
I had myself muted in two places. So what I do know, it's very limited because I'm not actually involved in all of that distribution of the injection. I do know that we have had folks going out into the nursing homes and some of the other ECFs to distribute the vaccine. I don't know what those numbers look like. And I don't really know what facilities, but I do know that they're out doing that. We continue to get daily emails and phone calls and about the vaccine, especially from people, older adults who are looking to get the vaccine. And again, it's my understanding there's a limited supply in the state of vaccine, a lot, but it's still probably not enough to take care of everyone. And it looks like the governor has put out some directives of who, what age, and that
Mhm.
kind of thing. So that's what I know on my end.
Yeah,
Okay.
I don't mean to interrupt, Harvey. You know, before I came on, I looked at our county website to see about mortality here in nursing homes, and we were at the number that I see was about 21% of those in nursing homes who passed away. 21% of the total mortality were residents in nursing homes, which is significantly lower than the national averages that might be as high as 45 and maybe percent or higher. If you have taken a look at the state's COVID dashboard and look at nursing facilities, I encourage you to do that if you haven't looked. You know, we still have multiple homes here in Summit County that have double-digit positive cases here in the last week. I don't think there's a facility across the state that hasn't been impacted by this, even if maybe we don't have an outbreak within a particular facility. All of these, some of the impacts that I mentioned here have occurred in facilities across the board, whether they have a direct, kind of outbreak in facilities or not. The Direction Home has been involved with a couple of initiatives, several initiatives to help with the isolation of residents in facilities. Companion pets have been made available to all the nursing homes in Summit County. We also have initiative underway to make laptop or tablets or other similar devices available to facilities. Specifically for residents, to allow them to connect with families and others, and the community at large. Those initiatives are underway and are part of the nursing home task force that just recently had a report out late last week.
See a couple of hands raised. Representative Galansky, did you have a question?
Hi, everybody. So I feel that, first of all, I love Summit County, and I'm just proud to be a resident here. And but what I want you all to know is that I volunteered with the governor to be one of the first people, not one of the first people, but someone who would receive the vaccine publicly, to try to encourage people who should be vaccinated to get vaccinated. And I'm specifically thinking of the home health care workers. And the reason for many reasons for that, but it just so happens that through my own family, I'm very connected with people who are home health care aides and home aides, dependent care aides, just a lot of things. And I think as a public servant, I should offer that platform to this group and to you, sir, who's given an excellent presentation. And I'm not trying to jump the line. I don't have any interest in that. My own mother is recovering from COVID. And if I could go physically take care of her in her nursing home in California, I would do that. So I just want to put that out to this group. Like I said, I offered that to the governor. He's got a lot on his plate and he hasn't gotten back to me. And I just believe that we can't wait any longer while the people that I know and care about and I'm close to are passing away. So thank you all on this call for your indulgence and grace. I understand there are a lot of concerns about people jumping the line and on, but I sit here in agony every day
Yep.
by the numbers of letters that I've had to write of constituents that have been lost to this. So I want to put that out there to the group, and thank you for giving me that time. I'm sorry, everyone.
No, thank you for your comments.
Yeah, those are great comments. And I couldn't agree more about Summit County. I think that we're really blessed and fortunate to be involved in this county, and the level of collaboration at all levels is really something to behold. So I appreciate that comment as well, Representative Galunski. I also see Mr. Fortnoff. You have your hand up.
Yes,
Go ahead, Alan.
I
Go
guess,
ahead, Alan.
I guess my question is that you talked briefly about some of these homes, all the different kinds of homes, maybe putting restrictions on people coming to visit if they haven't had the vaccine. My concern is that we're seeing a lot of people working at these facilities that are saying they don't want to get the vaccine. That's a really big concern to me. I know that it isn't really, we're not talking about the elderly, but we're talking about the elderly being, having to be there. And, that's a really big concern. Maybe the state representative also would be, have something to say about that I find that there is a huge portion of the people that are refusing are the STNAs, the helpers in those. And I don't know what the percentage is, but I know that many of them are African-American. And in the African-American community, there is a fear of these government type vaccines because of things that have been done in the past. What can we do to change that? And what are we doing to change that? To get that, to keep our relatives safe when they're in these facilities. I don't mind them saying to me, you have to get it because, as soon as I can get it, I'm going to go ahead and get it. I'm 69. I'm going to go ahead and get it. I have other health issues also. So I want to get it because I'd like to be able to expand what I do all day. But I'm concerned that so many people are not, and that's we should all be concerned about that.
And can I say one last thing? I'm so grateful, but really, I just want to be very careful. But given the last 7 days or so, I just think we need to quit. I've already thought through all the health issues or concerns. I'm offering this to you because I think it could make a difference quickly, that I would receive that vaccine in public, some kind of showing people that I got it, or maybe it's not public and it's not about me. I just think we're in a unique situation here for many reasons that we just need to get people vaccinated. And if that's an offer or something that could help, I just want to I don't even know the word anymore. I apologize.
I'd like to point out that when we're talking about Summit County, that because of the decision a number of years ago to amalgamate the City of Akron Health Department into the Summit County Health Department, that in reality, the Summit County Health Department is the health department for the City of Akron. So this is, in one sense, a seamless operation in that regard. So I don't know if everybody has thought about it that way, but it's an important point of awareness and interaction. Any other comments?
Karen, I see you have your hand up. Can you go ahead and share your question, please?
Sure, I will. Just as an aside to what everyone has been talking about getting one of the really important things that some scientific studies have done about people not being willing to take the virus or to take the vaccine is having access to reliable information. And so just so everyone here knows that the commission last week has presented a request to the city. The information on the CDC website is accessible to everyone, but it's not offered in different languages. And so we've asked the Health and Human Services Committee of the City Council to consider figuring out ways to translate the CDC information for the portion of our community that is not does not have English as their first language. So just from
You're
that.
how to connect.
But Sam, I have a question. There was a newspaper article recently in the paper about the group that Jeff Wilhite had got together. And it was unclear in some of my groups of what, so we had a nursing home that closed because of bad, rightly, it went through the processes of being cited and not making changes. And so it was closed down. And then that started a commission that apparently you're on, that Jeff Wilhite had started looking at Summit County and what our nursing homes here in Summit County. So is the end game to that to have additional legislation to nursing homes in Summit County, or is it just, or is there another purpose?
Well, Karen, I think the purpose of the task force is to improve the quality, broadly improve the quality of the homes in Summit County. Yes, there is a legislative group that's a subgroup that's part of that task force. But I think those types of changes will be, long in the future. I mean, months or years in the future. We know that how difficult it is to make those kinds of changes. But I think in the short run, we're going to focus on the task force. Really focuses on improving the quality of what we've got today. The group is not interested in closing nursing homes. Far from it. That's not at all what we have in mind. Let's see if we can improve the quality of care that's being provided.
Thank you.
Susan, I have a question. I just got a question. This is Francis. I just got a question from one of the foster grandparents. The question is, can seniors not volunteering due to COVID? If a senior receives the vaccine, will they lift the order on elderly volunteers, allowing them to return to volunteer services?
Boy, Francis, I certainly don't feel that I can respond to that. I mean, I think it will really depend on that. That's a broad question, and it will really depend on the scenario, the setting. Certainly, it will be a very individualized decision. I don't know that I can offer a broad comment. Do others have anything they want to add?
Susan, I'll mention that as you know, many of you know, the Ombudsman program utilizes a number of volunteers, dozens and dozens of volunteers making visits in facilities, and nobody either at the state office or here locally, we haven't looked at the situation yet of what if a vaccine, if a volunteer, an elder volunteer or a younger volunteer has been vaccinated, can they go back into the facilities and visit and be advocates and so forth? That question is looming, and we'll get there, I'm sure, regardless of where the setting may be. I think we're premature in kind of anticipating what's going to happen there.
But I think the important thing here is being able to raise the issue, be proactive as a commission, and aligning ourselves with the state policy so that we can have some input, or at least be prepared for decisions that are coming down the pike. I mean, the fact that we're having this discussion, I think is really important. And maybe if we were a little bit ahead, that's good, because with some of the priorities that we need to set.
Representative Galansky, do I see your hand up, or is that?
No, I think I needed to lower it. Sorry about that.
Oh, yeah, no problem. I didn't want to miss you. Mr. Is it Reisberger? I think.
Reisberg,
Yes?
can you hear me?
Yes.
So Sam, I think that the rest of the world now understands, appreciates how social we are as beings. And being the inspired director of the Akron Blind Center, isolation is a life that many lead, certainly seniors also included. We're talking about visitation and everything, but what I would like to see is someone to take the initiative to kind of pair up people and have a buddy system for seniors to kind of have like a pen pal. You have a phone pal that people can connect with and get just some communication, some friendly communication with others. Maybe to use your volunteers in that respect.
Right. I think that's a great suggestion. And many of you may know that facilities are trying to do that sort of thing as well. We have other groups. The probate court here in Summit County has a project underway of writing letters, as was suggested cards and so forth to residents. I think it needs to be personal. And I like the concept that you mentioned of a buddy system, if you will, or pairing a resident or residents with a volunteer. And I can assure you that's something that we will be looking into here with our volunteer corps at Direction Home.
Vantage Aging also does it for the community through their RSVP program. And I don't know if Ted's on the call, but he could probably speak to that.
Yes, I'm on the call. And yes, we're getting that up and running with our new RSVP director. That's certainly one thing we can continue to do to provide services during this time of COVID.
Good. Other comments?
This is Mary from Asian Services in Action. In regards to Scott's comment, I was wondering if you might want to contact Project Learn, because if you're talking about conversation, we have ESL students, and that could present a conversational practice for somebody who's learning English. Just a thought.
Very good creative thought.
I love that.
Yeah. Okay, other points of discussion? If not, we'll move on in our agenda, if that's okay with everyone.
Just quickly, I want to thank Sam for your presentation and for all your work, but certainly thank you for today's presentation. Very thought-provoking and very helpful. Thank you.
Thank you, and thanks to my tech support, Mary. I think that's mostly you to get my slides up. I appreciate your patience. Thank you. Have a great afternoon. I'm going to exit if that's appropriate. Okay. Thank you.
Okay. Looking at the agenda, Are there any special announcements at this time that any of the organizations want to make, or awareness of opportunities or information? This is the time to do it. Okay, that looks like a pregnant silence.
Sam, this is Lisa Mansfield. Since the card program got mentioned, I'll jump in real quick and just say that is still ongoing. We're accepting cards that are hope and inspiration for seniors in congregate care. Please write a message in something and send it to me at the probate court. I'll give the address and I'll put it in the chat as well. We're also collecting Valentine's cards for caregivers in those congregate care settings. So nurses, hopefully food service workers, all the people who've been on the front lines of this since day one. And, you know, as a society, some of our most underappreciated folks. I'm going to give the address out loud. You can send them to Summit County Probate Court. And I'll put this in the chat as well. 209 South High Street. That's 209 South High Street, Akron 44308. Please write a little message. It doesn't have to even have your first and last name. Put your first name, just put from a friend, just so that somebody knows you're thinking about them. We got 4,000 in the spring. For some reason, I think because everybody's been going through their stuff, a lot of the cards I'm getting this time are blank. I've hooked up with a poetry writing group that's helping me to fill some of those out so it doesn't have to all be me signing them, because Lord, that's a lot of cards to sign. We've gotten about 1,000, maybe a little less cards for seniors. Some that's divided between Valentine's and cards for seniors. So lots of opportunity on a dark day like today to put a little effort into either a blank card or make something. It can just be a folded piece of paper. I'll put it in an envelope. I'm donating a couple hundred of those. So yeah, help out. I'm going to put that in the chat.
Any other announcements, please?
Harvey, I replied to Karen earlier because she mentioned translating some documents and materials. I just want to let the group know that Asian Services in Action has an interpreting and translation services. So if anybody is interested to have materials translated or you're in need of interpreters, you can contact Asia. And I'll put the phone number in the chat. I'll also give it verbally. It's 330-535-3263 and ask for Ching. I'll do that right now in the chat.
So Mary, I'm assuming since you raised this issue last week, how important this is, that at least for the communities that you're working with directly, that the document that we received, are you already starting to translate that? Yeah, Mary, you're on mute.
Have resources been assigned, or?
If you need resources, I think you should let us know what's needed, and we can work on solving that.
Yeah, and that's what Mary, that's what we asked in our memo. We don't have any financial oversight with the city, but we asked Health and Human Service Committee to allocate city resources to do that. But they haven't responded to our request yet.
Oh, okay.
But if it would help us if you could take a quick look at the document and estimate what that cost would be, then we can work on that.
Oh, okay, I'll do that.
Okay, other comments?
Good afternoon. This is Robert Finn.
Yes, Robert, go ahead, please.
I just want to make sure that everyone reviews the bottom of the email that Francis sent out regards to the second round of economic impact payments. Those payments are being allocated as we speak, but most importantly, they are from the IRS, Treasury Department, not Social Security. How there is a phone number that is listed on the bottom of the email, 1-800-919-9835, which individuals can call. My point with that, not only to make sure that you call the right agency to make the inquiry, also, but if someone is getting that payment, and let's say the daughter, son, whoever may be the representative payee, that payment is the individual's. It is not the same as the Social Security payment. And so we hear the argument sometimes where the mother or father or whoever is receiving the payment will say, that's my money. When in this case here, that's their money. So just make sure that that if someone is contacting you regards to that, they can call themselves to that number, 1-800-919-9835, to inquire about that payment. Thank you.
Marilyn? Marilyn?
Yes, go ahead.
Sorry, I was on a Zoom call. Okay.
Okay, any other, if not, I'll move on to the review of the minutes from the December.
Uh-huh.
Are there any additions, corrections?
Uh-huh.
Hearing none. We will.
Oh, okay. All right. I'll do that.
We'll
Yeah, I
approve
haven't.
the minutes.
Okay.
We'll approve the minutes
All right.
as presented
Thanks.
by
Bye.
acclamation. Okay, let's now move on to old business. Age-friendly Akron update. I'll turn to our chair and co-chair.
Yes, age-friendly Akron, as I think most, if not all, on the call knows that the findings from the needs assessment was released prior to the holidays. We're now, that was as laborious as that was actually the easy part. Now we get to dissect it, think about it, and really decide and identify, so what are our priorities? Now knowing what we know, what are our priorities? What information do we need to move forward? And we will be, the commission will certainly continue that work and keep this group apprised. I'll mention that Summit, Age-Friendly Summit is proceeding with their own needs assessment. And we're hopeful in the summer, going into fall, that we'll be, kind of comparing the two and seeing what work we need to do. So get ready to roll the sleeves up, but I think we're in a great position right now.
So for those of you who may not be familiar, the Commission on Aging for the City of Akron is serving as the core committee. And we also have a broader based advisory committee, which is somewhere between 20 and 30 individuals representing a network of community agencies that we will now be reactivating in order to pursue the 8 domains. And so one of the things, if any of you have an interest in a particular domain, such as housing, such as transportation, such as civic engagement, I'm not going to go through all of them, but the fact of the matter is we are getting to start to zero in on each of the 8 domains. And then, of course, we may not actually be able to set priorities in all 8 areas. We have to focus in on what are the most important. So it doesn't have to be 8, it can be 4 or 5, whatever. So that's in motion. I must also tell you that our secretary, Francis Ladd, has been making a heroic effort to work on our outreach in terms of continuing our desire to have more focus groups, at least one focus group in each of our wards. And that will be in the next month or two, our primary focus, to try to get input through the telephone. We'll use a call approach to better understand the specific issues in different areas of the city. Francis, do you want to say anything about that?
No, thank you.
Well, I can tell you that it is challenging now, but we'll keep at it. So we're in movement there. I think that's great. Susan, anything else you want to say on that?
No, I
Okay.
mean, I think it's important. Yes, we have the empirical data that we, work so hard to garner. But I think it's also really critical to just continue to have conversations, listening. And in this time of the pandemic, that gets more challenging. But I think it's important for us all to continue listening and continuing to always be advocates for older adults. Always keep that ear open as to, what this can mean for an older adult. And we've said it once, we've said it many times, but what's good for an older adult is really good for the entire community. And so I think we all have to get used to looking at things, looking at initiatives, looking at progress, as far as what does this mean for the community at large?
Thank you. There was a recent discussion on one of our calls between our formal commission meetings. We're concerned about what services that we specifically have available through the city of Akron. And so one of the discussions was, what is the current status, for instance, if people are having difficulty bringing their garbage containers out to the curb, is the city still providing the service for people who are in need for the collectors to go and get that container? And there was also a concern about other type services. One example was someone who requested assistance with dealing with what they considered to be a severe groundhog issue. And what was the role of the city in that? Once, is there trapping? Is there animal pickup? We learned that there are specific charges that are currently charged by animal control. The issue was raised whether or not we as a commission should have increased sensitivity to maybe the needs of older adults on limited income and what kind of services we can support. It leads to a more general discussion about which of the areas of city services we may need to pay attention to make sure that people are getting the help and support that they need. Can anybody help me to share that further? Or have I covered it?
I think
May I ask the question?
Sure, go right
May
ahead.
I ask the question? What is the city doing about raccoons and possums in your yard? They're so bad. Mine has put a hole in the side of my house. They're getting under my porch. They're knocking the garbage cans over. And I need something. I'm a senior citizen and I just don't know what to do.
Well, that's exactly the kind of thing we're talking about. If you could let Francis Ladd know more about how to reach you, we'll see what we can do to follow up. That's exactly the kind of thing that I don't know if I have an answer for you yet, but it's the kind of issue that we wanted to be responsive to. We feel that that's part of our mandate.
Yes.
And
well, thank you very much.
I can tell you, I have over the years had many groundhogs. They seem to really like my backyard. So, but I also have paid a lot of money to have them removed. And so not everybody can afford to do that. So I'm concerned about that. And raccoons, really very intelligent animals, if those of us who have had to deal with them. And many of us have the luxury of all kinds of deer roaming through our backyards too, munching and crunching everything that we like to see, flowers, vegetables. So that is an issue. So please, Mrs. Landrum, can you get in contact with Francis and let her know the details so we can follow up on that?
Yes, I certainly will.
Anyone else have exciting challenges that are being presented by the world of animals or humans for that matter? Okay, any other comments or concerns at this point? Just for those of you who attend our annual, not annual, our monthly commission meetings, I want you to know that many members of the commission talk to each other at least once a week, trying to monitor changing circumstances, ongoing issues, so that we are what's happening. We're trying to be responsive to changing demands and concerns. So feel free to contact me or Secretary Francis Ladd or any members of the commission. We're also working hard to try to make access to the commission on our website more accessible. And I want to remind everyone that we have a great resource in Getting Wiser that is out there, that if you're not aware of it, please pursue that. We know, unfortunately, or fortunately, I guess unfortunately, from Age-Friendly Akron, that there are an awful lot of people out there who do not realize the potential assistance that they can get from Direction Home. They don't know what resources are out there in terms of Getting Wiser. And even something as well known as 211 and 311 still is not apparent to a lot of people. So that's something we should be working on further. Anything else we can do that may be useful? If not, the chair is willing to accept a motion for adjournment. Okay, I see a hand raised by Karen Hedlicker.
And I second it.
Okay, non-debatable motion. All in favor, please say aye.
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 Okay, thanks, everyone. Let's keep up the good work. Let's do everything we can to cooperate with each other to get through what are probably the most challenging times that any of us, for those of us who study the demands of different cohorts as it affects the field of aging. This perhaps is one of the most demanding periods. There's been nothing like it since the Great Depression in some respects. And so these are clearly unique times. And we as a city have the opportunity, and as a county, to do really good work by being extraordinarily concerned and committed. And so, I believe in the Yogi Bear philosophy. We want to be better than the average bear. So let's see if we can do that from the commission perspective. Okay, let's all say goodbye.
All right.
Bye. Thank you.
Thank you, Dr. Stearns. Thank you, everybody. Thank you, Sue.
Yep.